Okay, we go to the gathering points. The meeting for 13 complete Shang. The location is in the anterior and inferior to the free end of the 11th rib, approximately 1 tune superior to the umbilicus. To locate, the quick method is to ask the patient to press their flexed elbow into 90 degrees against the lateral aspect of the thorax, and the tip of the olecranon will be pointing to the free end of the 11th rib. So liver 13 can then be located on its anterior and inferior border, or place the hand on the upper abdomen and with gentle pressure palpate along the lower border of the rib cage until you feel the free end of the 11th rib just superior to the umbilicus. To locate liver 13 on its anterior and inferior border. Located on approximately the same level, 1 tune superior to the umbilicus, are rent 9 on the midline and stomach 24, 2 tune lateral to the midline. GB25 is located more laterally and inferiorly at the free end of the 12th rib. So sa needling, 0.5 to 1 tune vertically or better obliquely in a lateral direction. Portion, peritoneum, hypertrophied organs, right. Sa right, we have the liver, and sa left, we have the spleen. Action, indications, it harmonizes the liver and the spleen, regulates liver qi, especially in the middle and lower border, strengthens the spleen, opens the channel. Special features, it is the front move point of the spleen, meeting point of the Dao-mai and the GB channel. U meeting point of the Zang organs. Liver 13 is very much used whenever liver qi stagnates and invades the stomach and spleen, preventing spleen qi from ascending, resulting in loose stools, diarrhea, and abdominal distension, and stomach qi from descending, resulting in retention of food, belching, and fullness in the epigastrium. The use of this point will promote the smooth flow of liver qi and eliminate stagnation, as well as strengthen the spleen. It is therefore the main point to use whenever liver and spleen are not harmonized. Typically, the pulse is wiry on the left and weak on the right. Needled with reinforcing method, this point can also be used to tonify stomach and spleen. If moxa is used in addition, it can tonify and warm the spleen in deficiency of spleen yang. Now we go to the liver 13 summary of functions. It promotes the smooth flow of liver qi and harmonizes the liver and spleen. The hypochondrial distension, pain in the ribs, abdominal distension, and pain, diarrhea, undigested food in the stools, borborygmi, constipation. Tonifies stomach and spleen. If moxa is used in addition, it can tonify and warm the spleen yang. Zhangmen liver 13, located midway between the middle and lower jaw, is both a point of the liver channel and the front move point of the spleen. The term move means to gather or to collect. The front move points are where the qi of the Zang-Fu gathers and concentrates on the anterior surface of the body. Zhangmen liver 13 is therefore an important point to harmonize the relationship both between the liver and spleen and between the middle and lower jaw, with emphasis on disorders of the abdomen and intestine. According to standards of patterns and treatment, the essence of the 5 Zang is all transported from the spleen. As the origin of the postnatal qi, the spleen and stomach are considered to play a central role along the Zang-Fu, transforming and distributing the essence of food and drink throughout the body. For this reason, the spleen may be said to dominate the Zang and the stomach, the Fu. The close relationship of Zhangmen, liver 13, to the spleen, therefore, is further reflected in its status as the meeting point of the Zang, in the same way the Song 1, Ren 12, the front move point of the stomach, is also the meeting point of the Fu. The liver tends to excess patterns and the spleen to deficiency. Liver-spleen disharmony may originate either from the liver when Qi stagnation aggressively invades, obstructs, and suppresses the transportation and transformation function of the spleen, or from the spleen when the spleen Qi deficiency is unable to resist the encroachment of exuberant liver Qi. This process is reflected in saying anger is hard and the Zang-Fu are soft. That is hard easily endures what is soft, and by Sang Jing Shu observation, if anger occurs during or after eating, it injures the stomach and spleen. The origin of liver-spleen disharmony, therefore, may be either an excess condition of the liver or a deficient condition of the spleen, or a combination of the two. One characteristic of this disharmony is the fluctuation in severity, of symptoms with changes in the emotional state and the tendency of either liver Qi stagnation or spleen deficiency to predominate at different times. Zhangmen, liver 13, which is able to both to regulate the liver Qi and to tonify the spleen, is the main point on the abdomen to treat all gradation of liver-spleen disharmony, giving rise to symptoms such as propensity to anger, distension, and pain of the abdomen, borborygmus, diarrhea, and loss of appetite. The diarrhea due to liver-spleen disharmony is distinguished by two main characteristics. The first is that the diarrhea is often preceded by distension and pain, both of which are relieved by after passing stools. The second is that diarrhea frequently alternates with constipation, for which this point is also indicated. This pattern, frequently encountered in irritable bowel syndrome and premenstrual bowel disorders. Zhangmen, liver 13, may also be used for spleen disharmony without liver complications, or liver disharmony without spleen complications. Through its action of fortifying the spleen, it is indicated for weariness of the limbs, emaciation, injury to the stomach and spleen from overindulgence in eating, and diarrhea containing undigested food. By resolving liver Qi stagnation, it is able to treat esophageal constriction, fullness of the chest, focal distension, pain of the lateral costal region, and constipation. If liver Qi stagnation leads to stasis of blood, there may be abdominal masses, and in terms of Western medicine, enlargement of the liver and or spleen. If liver Qi stagnation transforms to fire, there may be agitation and heat with a dry mouth, mad walking, and propensity to anger. If the liver is deficient, there will be a propensity to fear. If liver Qi invades the stomach or lungs and impairs their descending function, there will be vomiting, cough, or dyspnea. Through its dual action and the liver and spleen, Zhangmen, liver 13, is also able to drain dampness or damp heat from the middle or lower jaw with such symptoms as jaundice and frequent urination with turbid white discharge. Liver channel is interiorly exteriorly coupled with the gallbladder channel, which controls the sides of the body and facilitates turning and bending. Zhangmen liver 13, a meeting point of the liver and gallbladder channel, is located close to the waist and lumbar region and is indicated inability to turn and bend the waist. The Greater Compendium of Acupuncture and Moxibustion recommends Zhangmen liver 13 for cold and pain of the lumbar spine, while Xu Shi Miao in 1,000 Ducat formulas is more specific and recommends it for cold and painful lumbar spine in men. Finally, liver 13 is indicated for the pattern of running piglet qi arising from severe stagnation of qi. According to the essentials from the Golden Cabinet, running the piglet disorder arises from the lower abdomen. It rushes up to the throat with such ferocity that the patient feels he is close to death. It attacks and then remains. It is brought about by fear and pride. Running piglet qi primarily arises when stagnant liver qi transforms to heal or when kidney yang deficiency leads to accumulation of cold in the lower jiao. In both cases, qi is violently discharged and rush upward along the penetrating vessel. In clinical practice, running piglet qi may be encountered in a number of variants, all involving a rushing sensation, usually upwards along the trunk, back, or limbs. It is usually accompanied by feeling intense anxiety. Thank you for your attention.